Good evening. Minister of Health and Wellness Dr. Christopher Tufton today signed contracts with 4 private health facilities under the public-private partnership component of the Project Code Care initiative. Now, these facilities will serve persons in the Southeast Regional Health Authority SERA, which covers the parishes of Kingston and St. Andrew, St. Catherine and St. Thomas. Dr. Tufton, in addressing the media, said that the COVID-19 pandemic has greatly affected the way that the health services systems deal with the surgical backlog.
Certainly an issue too if you have to wait for 6 years or 3 years or 2 years that you can't afford it. Because if you could, you would go into the private space to pay for it. A hernia surgery could cost you, 300,000 or more, and many Jamaicans just cannot afford it. So we concluded a couple of things. Anybody waiting over 6 months are likely not to have the economic wherewithal, even with their diaspora sending some support for them, to pay for some of these procedures. So they wait and they wait and they wait. So any hope of them spending it in the private space is unlikely because they just don't have the money. Secondly, because COVID has amplified that challenge, we went up to about 7,000 or 8,000 people waiting, and we picked out the ones that were the longest waits, but also some of the less complicated procedures, because we also appreciated that we wanted to minimize inpatient care. And so to the extent that we could treat with these patients and they have a 1 day, maybe a 2, unless some complications develop, or none at all, day surgeries, then we should try and get those out of the way and outsource those to the private sector. And this is where we are. So we have set a target of 2,000 surgeries. We have convinced the surgeons, who are not very easily convinced in the public institutions, to give up those cases and to coordinate. That's a whole new dimension of accepting the public-private arrangement.
Dr. Tufton also said that Project Code Care is a mission geared at reducing the surgical backlog by 2,000 over a 12-month period, and also at reducing wait times for elective surgeries to less than 180 days.
COVID has had a number of side effects, and one of the side effects, as I term it, of COVID was the extent to which we had to prioritize the COVID response to COVID-related matters, and where we had an option to delay certain procedures, we exercised that option, and surgeries and elective surgeries in particular gave us some wiggle room to exercise that option, to prioritize the COVID. Now, prior to that, to be totally frank, we were doing a similar thing, maybe not at that rate, where emergencies were always prioritized. And we have a very high trauma society for whatever reason, self-inflicted including. More often than not, the public health entities and surgeries in particular are prioritized to those emergencies that come in every day, pushing back electives on a consistent and ongoing basis. Once we sort of got at ease from COVID, even though it's still around, we assessed the critical side effects, mental illness being one, surgery backlog being another, and concluded that we needed to do something special to try and pick up and cover some of this lost ground. Because at the end of the day, this is not a statistic, it's really about people. And people are suffering for years in some cases, 3, 4, 5, I've even seen a 6-year wait for a hernia surgery. And one can only imagine the pain and the suffering that Jamaicans are undergoing.
Dr. Tufton further explained the importance of ensuring the care of surgical patients, especially those who have been on a waiting list for a long period of time.
Certainly an issue too if you have to wait for 6 years or 3 years or 2 years that you can't afford it. Because if you could, you would go into the private space to pay for it. A hernia surgery could cost you, 300,000 or more, and many Jamaicans just cannot afford it. So we concluded a couple of things. Anybody waiting over 6 months are likely not to have the economic wherewithal, even with their diaspora sending some support for them, to pay for some of these procedures. So they wait and they wait and they wait. So any hope of them spending it in the private space is unlikely because they just don't have the money. Secondly, because COVID has amplified that challenge, we went up to about 7,000 or 8,000 people waiting, and we picked out the ones that were the longest waits, but also some of the less complicated procedures, because we also appreciated that we wanted to minimize inpatient care. And so to the extent that we could treat with these patients and they have a 1 day, maybe a 2, unless some complications develop, or none at all, day surgeries, then we should try and get those out of the way and outsource those to the private sector. And this is where we are. So we have set a target of 2,000 surgeries. We have convinced the surgeons, who are not very easily convinced in the public institutions, to give up those cases and to coordinate. That's a whole new dimension of accepting the public-private arrangement.
Still making the news tonight, 8 American cruise ship passengers were arrested yesterday after allegedly attempting to leave the island with cocaine valued at over 130 million Jamaican dollars. Now that's just about 850,000 US dollars. The police say they believe the Americans are part of a transnational drug trafficking syndicate operating between the United States and Jamaica. According to the Constabulary's Corporate Communications Unit, CCU, the 8 cruise line passengers arrived in Ocho Rios, St. Anne from Miami, Florida on Wednesday and disembarked the vessel. Reports indicate that at about 1:30 p.m., the cruise ship passengers were reboarding the vessel for departure when certain anomalies were reportedly detected in their luggage. It's further understood that during a search by members of the Narcotics Division, a total of 24 packages containing the cocaine, weighing just over 17 kilograms or 38 pounds, were found concealed in their bags. The passengers were subsequently arrested for breaches of the Dangerous Drugs Act. The police say the identities of the passengers are being withheld pending further investigations. Still making Mello TV news tonight, an assault rifle was handed over to the Port Maria police in St. Mary yesterday under the government's gun amnesty. Commissioner of Police Major General Anthony Anderson yesterday conducted a site visit in Port Maria. Speaking with the media, Major General Anderson said the handover to the Port Maria police is a clear signal that illegal firearm holders are willing to take up the amnesty. Anderson also said that a rifle has come in, as well as rounds, and someone else turned in rounds in St. Mary. He added that this scenario is taking place across the country. The amnesty, which was enacted through the Firearms Prohibition, Restriction and Regulation Firearms Amnesty Order 2022 and resolution passed by Parliament, began last Saturday and will end on November 20. It gives holders of illegal guns one last chance to turn them in and avoid tough sanctions, including a mandatory 15-year prison sentence that are included in Jamaica's revised firearm law. The police commissioner appealed to persons in possession of illegal guns to take up the amnesty. Continuing with the news tonight, motorists with outstanding traffic tickets are being urged to pay up before December 1 ahead of the expected operationalization of the Road Traffic Regulations 2022 early next year. This appeal comes from Director of the Island Traffic Authority, ITA, Canute Hare, who pointed out that under the Road Traffic Act 2018, which the regulations bring into effect, the driver's license of a motorist with one outstanding ticket will not be renewed. He added that what the ITA is doing now is educating people and are empowering the people to hurriedly use this month of November to pay up all outstanding traffic tickets, as warrants could be issued on Christmas Day, New Year's Day, and Boxing Day. Hare was participating in a panel discussion during the staging of Red Stripe's Responsible Alcohol Consumption and Road Safety Town Hall held at its headquarters on Spanish Town Road on Wednesday. The ITA's director also had some stern words for unruly motorists intent on not complying with the new regulations. He warned them not to test the ITA because the long arm of the law will catch up to them, adding that persons should not ask for leniency as no chances will be given. As we continue with the news tonight, fisherfolk and stakeholders who were affected by the Rio Cobre pollution during the period of July 26 to August 4 this year are to receive $16 million in compensation. This was announced by Senator Matthew Samuda, Minister without portfolio in the Ministry of Economic Growth and Job Creation, who pointed out that this will come from the $117 million Environmental Performance Bond, which the National Environment and Planning Agency NEPA has drawn down from bauxite company Windalco.
$15 million initially for the fisherfolk who have been impacted, and we have committed to, in line with the Ministry of Agriculture's assessment for farmers and fisherfolk, provide greater assistance as we come to new budgets. This would have happened during the middle of a budget cycle. We wouldn't be able to react in that way in the short term. However, we have committed that in line with the Ministry of Agriculture and Fisheries assessment of about $55 million of displacement to address the shortfall in other budgets.
In a Mello TV News update, Chairman of the People's National Party PNP, Dr. Angela Brown Burke, says she is disgusted at the repulsive and racially charged comments levied against PNP leader Mark Golding by Everald Warmington over the weekend. Speaking at a St. Catherine Northeastern Constituency Conference on Sunday, Warmington, a member of Parliament for the ruling Jamaica Labour Party JLP, reportedly asserted that opposition leader Mark Golding will never become Prime Minister of Jamaica because of his skin color. In a statement today, Burke said Warmington's comments were despicable and in poor taste. She added that the comments are offensive to Mr. Golding and all Jamaicans, but also insults the country's motto, out of many, one people. She also explained that Mr. Warmington's comments are as incorrect as they are offensive, as Mr. Golding hails from a family that exemplifies the true meaning of service over self. His father, Sir John Golding, was integral to Jamaica's recovery from the polio epidemic in the 1950s. He established the Mona Rehab Center, renamed the Sir John Golding Rehabilitation Center, the Hope Valley Experimental School, and other institutions catering to the needs of persons living with disabilities. Today, Mark Golding chairs the Sir John Golding Rehabilitation Center and continues his father's outstanding legacy. Few families can claim a legacy so deeply cemented in service to Jamaica's most vulnerable. Mrs. Brown Burke highlighted that Golding was born in Jamaica at the University Hospital of the West Indies and that his nationality and heritage are of unquestionable authenticity. The chairman said she hopes that Prime Minister Andrew Holness and General Secretary of the JLP Horace Chang will distance the political party from Warmington's statements. Mrs. Brown Burke went on to say that although Jamaica has come to expect very little from Mr. Warmington with respect to decency and character, they are sickened by this latest display, and the public is even more turned off from the political process. She said the matter is receiving attention from the political ombudsman. Yesterday, the private sector organization of Jamaica, PSOJ, said it was disappointed with what it called racially divisive comments made by Everald Warmington. And those are the stories making news. I am Shelley Hill. Do stay safe, pleasant viewing, and thanks for watching.